Hi everyone, thanks for joining. We're going to get started now. Just a reminder, we have approximately 30 minutes, one question, one follow-up. We have Dr. Moore here today, so I'll turn it over to him for some brief remarks.
Good afternoon, everyone. Today, there are 564 new cases of COVID-19 in Ontario. There are 295 people in hospital and 190 in intensive care due to COVID-related critical illness. And I'm sorry to say that there are another 3 deaths that have been reported. Our vaccination rate continues to climb. Currently, 83.7% of eligible Ontarians have 1 dose and 77.2% have 2 doses of a COVID-19 vaccine. But we must see these rates climb higher in the face of the Delta variant. Data from the science table indicates that people who are unvaccinated are 7 times more likely to be infected with COVID-19 than people who are fully vaccinated. When reviewing who is currently admitted to hospital for a COVID-19 infection, people who are unvaccinated are 24 times more likely to be in a hospital than those that are fully vaccinated. And among those in the intensive care, people who are unvaccinated are 43 times more likely to be a patient compared with people who have been fully vaccinated. Data from Public Health Ontario further demonstrates that as a result of the direct effects of Ontario's vaccination program, an estimated 63,000 cases of COVID-19 have been prevented among individuals 18 years of age and older. And an estimated 4,238 severe outcomes, such as hospitalization or death, have been prevented amongst individuals 70 years of age and older. What these data tell us is that vaccines are working. Vaccines are safe, they're effective, and are preventing Ontarians from being admitted to hospital and dying from this illness. But in the face of the Delta variant, we need to be humble, be flexible, and be prepared to react quickly to minimize the transmission until more of us are vaccinated. We have been preparing with all our partners over the summer for the anticipated surge in cases. We will follow the data daily and react with appropriate public health measures. Locally, regionally, and provincially, we will be prepared to minimize the impacts of any surge in illness. We must be proactive to avoid reactive closures, and that means looking at the best evidence and practices to maintain a strong chain of protection. And our planned proof of vaccination program is one of the many ways we are being responsive to protect Ontarians from the impacts of COVID-19. And since the proof of vaccination program was announced, we have been seeing an increase in the number of people coming forward and getting vaccinated. Our first dose 7-day average has increased every day from Wednesday through to Sunday. This increase has been almost entirely amongst people aged 18 to 59, and among these cohorts, the younger the group, the larger the relative increase. Thank you to everyone who's rolled up their sleeve, and thank you to everyone who has played a part in Ontario's vaccine strategy. Just in terms of back to school, I want to take this opportunity to wish our children and young adults a safe and happy return to school, to their college or to their university. This is an exciting time, and we have made incredible strides as a province to confidently get our children back into the classroom. It is time for our children and youth to see their friends, to socialize, and participate in extracurricular activities. This is crucially important for their mental, physical, and social well-being. Over the past few weeks, I know a lot of parents were in preparation mode, organizing backpacks, buying pencils, shoes, and masks, and I hope that a COVID-19 vaccination was a part of that checklist. If not, it's never too late to get vaccinated. If you have children who are eligible to receive the vaccine, please do not delay in taking them to get their shot. It will protect them and their school and their community, making it a safer return to the classroom for all. And to parents with children under 12, there is no vaccine available for that age group yet, and it's our collective responsibility to continue to protect them by surrounding them with those who are vaccinated and adhering to all the best practices. So if you have not done so already, please get your shot. As parents, it's also important to review the recently updated COVID-19 screening guidelines for schools and childcare. Please screen your children every day before school. The symptoms most commonly associated with COVID-19 among children and youth include a fever or chills, a cough that is new or worsening, shortness of breath, nausea or vomiting, decrease or loss of taste or smell. If your child is experiencing any of these symptoms, they should not attend school in person, should self-isolate immediately, and seek testing as soon as possible. And if your child is experiencing any other symptoms of illness that are not included on the COVID-19 list, such as a runny nose or a sore throat, it's important to keep them home until their symptoms are resolving for at least 24 hours. It isn't only our young kids returning to the classroom. To our post-secondary bound Ontarians, I wish you every success this coming year. And as you return to campus, please make sure that getting vaccinated is on your to-do list. Post-secondary education institutions have been working hard to ensure that their campuses are as safe as possible, and I want to applaud their incredible efforts. As our kids return to the classroom this week, I know there is likely a mix of emotions, excitement, nervousness, and worry. But please know that we are doing everything we can to build the safest environment possible to help them ensure that our children stay in school for the entire academic year. That is why there are a range of public health measures in place to support healthy and safe school environments. In addition to the investment in ventilation and all those improvements, we're maintaining masking, screening, hand hygiene, enhanced cleaning and distancing. It's our duty to keep our schools safe, also by getting immunized. An ever-increasing level of community immunity is only going to increase the strength of all of these measures. And as we continue our last-mile immunization strategy, the introduction of a proof of vaccination policy will help to encourage every eligible Ontarian to get their shot, to keep our community safe and the province open. Immunization is key to protecting ourselves, our loved ones, and our most vulnerable. Please roll up your sleeve and please get vaccinated now. And with that, I'll turn it over to the media for any questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Paula Larigia from the Canadian Press. Please go ahead.
Hi, Dr. Moore. You're praising parents who get their kids vaccinated before sending them off to school. You've had, over the last few weeks, several groups ask for COVID vaccinations to be added to the list of mandatory shots for students. So far, you've kind of postponed making a decision on that. When is a decision coming? Why hasn't that happened before school started? And are you just waiting for a vaccine to be approved for kids under 12?
Oh, so several questions there. Just in terms of the vaccine for 5 to 11s, we have heard from the federal government that that's being reviewed, that we may get information in early winter regarding possible rollout for that population. So I'm looking hopeful that we'll have it during that time frame. In terms of mandating the reporting of vaccination, what we've done is we've worked with our health units and our school boards and have created an electronic solution to minimize the burden on parents on reporting, so that now we'll be able to get an electronic record of who is in what class in what school. That will get integrated into our COVAX tool, so we will understand at a local public health level how many children are immunized in each classroom and in each school. So this is a seamless electronic means that will allow public health to understand who's vaccinated in what classroom and what proportion of schools have high levels of protection. So we've gone beyond the requirement of mandating a parent to report to making it seamless and electronic, and we've informed the Privacy Commission regarding this. This is a real-time means by which public health will understand risk in any school. We will have COVID-19 activity in schools across Ontario. That's natural. It reflects what's going on in the communities. But now we have this additional electronic availability that enables public health to understand in almost real time the risk in any classroom. So I think that is the best solution in a short time frame that we could achieve, and I think it meets the needs of public health, it meets the needs of parents as well as school boards.
Follow-up?
So the runny noses were recently removed from the list of screening symptoms for having to keep kids out of school, but you've just said now that parents who have a child who has a runny nose should also keep that child out of school. So can you give some clarity as to what parents should be doing if their kid has a runny nose, and why was that removed from the list of symptoms from the screening?
Very good question. So we did an evaluation, and many health units contributed to this. Of the 100 children that got tested for a runny nose, only 1 out of 100 would have tested positive for COVID. We thought that was an undue burden for parents to try to find one child to test 99. The vast majority of them would have had an allergy or rhinovirus, which is very typical this time of year, and it would have been an undue burden on parents and schools and the testing capacity of the province. So given that low positivity of just the one symptom of runny nose, we've excluded it. It will, though, require, if you have a runny nose, to stay at home to see if the symptoms are resolving or improving, and the child could then report back to school. So we thought, from a patient perspective, a parent perspective, this was the best solution.
Next question.
Your next question comes from Mike Crawley from CBC News. Mike, please go ahead.
Hi, Dr. Moore. How confident are you that these plans that are in place for schools are strong enough that school closures aren't actually going to be necessary?
Good question. Good analysis from our federal partners across Canada that looked at where children actually pick up COVID-19. And this was just recently shared with us last week. 87% of the time when a child got COVID-19, the virus actually spread within the social circumstances, in the home or after school activities. Only 7% of the time was the school the source for the infection. And the remaining percentage, around 6%, was in daycare settings, preschool, after school. So I am confident that the school setting itself is safe. We've put in many precautions. We will see outbreaks, we will see activity in the schools, but they basically reflect what's going on in the community. Our goals as a community should be to keep our rates as low as possible, and that way our schools will remain safe. And parents, we all have to be very cautious of our after-school activities. The more contacts we have when you have COVID-19 in your community, the higher the risk that your child is going to get the infection or illness. And so we all will have to be cautious as the rate and risk increases, and we do anticipate increasing in the coming months. We'll have to reassess how we socialize after school settings. We have also done tabletop exercises with all of our school boards to prepare them in partnership with their local public health agencies for outbreak management. And it's our goal to be very precise and limit any effect on schools, classrooms, and or broad-based closures by being aggressive in outbreak management, by limiting the spread spread in communities, and also adhering to all the best practices in the school settings. So I'm confident, but it takes a community to keep our schools safe and keep our community rates low, and many communities are doing that as we speak. And where there are increases in activity, and I'll just use Windsor as an example. The Medical Officer of Health, Dr. Wajid Ahmed, has already put in recommendations because their rate of illness is around 100 per 100,000 today. He's put in recommendations in partnership with the school boards to limit assemblies, limit high-risk sports, to best adhere to cohorting, hand hygiene, and other public health practices to limit the spread, and in that way further protect our schools as a possible source for infection for children. So I hope across Ontario that we can work at a local level to protect our schools when we see community rates go up, but we all have an obligation to keep our schools safe by getting tested, isolating if you're positive, and letting public health do its great work on finding and limiting the spread of infection in all communities in Ontario.
Follow-up?
Well, specifically on testing, there's been some criticism that the province's testing strategy for schools isn't going to be adequate. Given that the rapid take-home testing program is only targeted at secondary schools, how can you say that the testing regime is actually going to be strong enough this fall?
Oh, great question. So we've done the science on this and have worked with many universities in Ontario and McMaster in particular on modeling the effects of rapid testing. And it's a burden. It's a burden for parents, and there is a cost associated with it. And the modelers and infectious disease experts have told us once we get rates of illness above 100 per 100,000 in a community, there may be a slight benefit to doing asymptomatic rapid antigen testing at a school setting, especially if it's in a high-risk community. I've worked at a local public health agency level. We can sub-analyze our communities to know what schools are at risk and put in antigen testing in that environment. But a broad-based antigen testing in communities like ours in Ontario, where we generally, compared to any international standard, have low risk of disease, the burden of the testing, the benefit of the testing doesn't have a significant benefit on limiting the spread of disease, and the cost of it is not an effective means of limiting spread. So we've done our homework, we've done the analysis, we'll use that tool if and when community rates are high, but that's much higher than where we're at right now.
Next question.
Your next question comes from Rob Ferguson from the Toronto Star. Rob, please go ahead.
Hi, Doctor. I noticed that in the stats today we had a nice bump on vaccinations on Thursday and on Friday, but it really tailed off the weekend. What are you expecting this week? Do you think it will pick up again? And do we need more measures on the vaccine front in terms of incentives or more clinics? Do you think there's enough clinics out there?
Oh, great question, Rob, and thanks. We knew that on a long weekend, people were going to take advantage and enjoy the great beauty of Ontario. We hope that this week they'll come back with a renewed interest in being immunized, especially with the verification process starting on September 22nd. We hope that will be an incentive for many to become immunized, and I do hope our numbers will increase throughout this week. We are still making slow progress, but if we stay at this pace to get to a high enough protection level, so over 90 could take an additional 60 days if we stay at this pace. So I'm optimistic that Ontarians will step forward. We have around 800,000 Ontarians that we'd love to be able to provide their first dose to, and around 1.6 million, if you include that 800,000, we'd like to provide their second dose to. It's a call for arms, for them to come forward and to reap the benefits of being able to access so many other environments as of September 22nd, along with the other vaccinated Ontarians.
Follow-up?
Yes, thanks, Doctor. Do you have any other strategies up your sleeve if by the end of this week you don't see a pickup? What more could be done, do you think, at that point?
So we'll be unveiling further, I think, next week, the further details of the last mile strategy. We have one of the most robust immunization policies that have been put in place of any province. We've created immunization policies for our acute care sector, our home care sector, community sector. I've put in a letter of instruction to all colleges and universities to have a immunization policy in play. And I was happy to report at Queen's that they're at 98% of students have had both doses in residence, which is incredible statistics. And thank all of the colleges and universities that have worked over the summer. We've also had letters of instruction on licensed retirement homes to have immunization strategies, women's shelters, and other congregate settings. And we'll continue to have immunization policies in high-risk settings where we want to protect vulnerable members of our community to incentivize further immunization strategies. I'm monitoring the data on a daily basis like it sounds you are, and I do hope we'll have an uptick in the near future. After a long weekend like this, we normally do see the increase in cases of COVID-19 later in the week. And I think once people realize this virus isn't going away, the risk will continue throughout the fall and into the winter. That alone should be an incentive to come forward and get protected. The stats show it. 7 times higher risk of getting COVID-19, 24 times higher risk of getting hospitalized. And when you get hospitalized, it's because your lungs are filling up with fluid and you can't get oxygen into your bloodstream and you're fighting for air. And then to get admitted to the intensive care unit, it's a 40 times higher risk. And if you're getting admitted to the intensive care unit, it's because you cannot breathe on your own anymore. No one wants to see that happen to any of our loved ones. We want to protect those that are unvaccinated right now, and we need you to come forward and get immunized to protect yourselves, your community, the health system, and all of your loved ones. It's a call for arms immediately.
Next question.
Your next question comes from Adrian Gobriel from City News. Adrian, please go ahead.
Thanks so much for taking my question. A couple of follow-ups to Mr. Qualley's questions earlier around the first one around testing. There will be a pilot for take-home PCR tests. When it comes to rapid testing, you say that the testing, that there's a cost involved and a burden to parents. Many say that the pilot around the PCR test, because they'll take a day or two for the results to come back, it won't actually keep COVID out of our schools. Though take-home rapid tests, similar to programs we're seeing in the UK and in Germany, would stop the spread in schools because students would be taking it before they come in. Would it not make sense to be proactive and not wait until testing rates get out of control, or COVID rates get out of control?
No, thank you so much, Adrian. Really good question. So important to understand that our rate of illness is so much smaller than the UK. So we're roughly at 33 cases per 100,000 per week in Ontario. Alberta is at 5 times that, and British Columbia is 3 times that. But England is at least 10 times higher risk. They're over 300 per 100,000 per week. And the United States, where they're doing testing in the southern United States, antigen testing, rates that are well over 300 per 100,000, and with no immunization strategy of any significance, very low uptake in many of the southern United States, and UK hadn't immunized their children from 12 to 17, and hence we're in a different environment. We are approaching 73-74% of our 12 to 17-year-olds already immunized and protected, and a tenth the rate of illness where antigen testing may have benefit in those settings. So it's a tool. It's a tool that we will use wisely and will put in play if our risk goes up. but at present, there's no additional value to implementing it, given the low risk. We'll see more false positives than true positives, and that burden means you then, after an antigen test, have to go through a PCR test, and you have to stay home until the PCR test is back. That's an undue burden when we're in a low-risk environment at present. But we look at the evidence for all of these interventions on a regular basis, and we'll put them into play if we think there's value, if it will help us keep our schools safe. But as I said previously, our schools are not the risk. It is the community activity that's the risk, and we all have to play our part on reducing the activity levels within our communities.
Follow-up?
Thanks. And another follow-up around school safety. You had mentioned that 87% of the time the virus spread within social circumstances. Only 17% of the time was it in schools, though, I'm going to guess that data was before we were dealing with the Delta variant as the dominant strain, because schools have been closed for 6 months. So when it comes to elementary schools where kids aren't vaccinated, do you remain adamant that the school setting is safe? Because really that's what parents want to know this week as they're sending their kids back.
Yeah. So it was 87% of the time it was in a social environment, and you're right, it would have been, it was Canadian, and so any school closures in Ontario, that data would have had a broader base of population information, and it wouldn't have caught Delta. 7% in the school setting, and then 6% in daycares or preschool or after-school activities. So the school remains a low-risk environment. I do think that the precautions that we put in play in Ontario and the investments that we've made are world-class and will reduce the risk, but not eliminate the risk. Delta is highly transmissible. It is a virulent strain of COVID, and we are constantly humbled by how this virus can change and can spread, and we all have to be resilient and adaptive to it. We've done a significant amount of work to protect elementary students, but it takes a community to protect them further, especially after school activities. We recently released the testing strategy for workers, so those around students in the elementary and secondary setting. I think that's an additional layer of protection that will help minimize exposures, but the teachers already have done well just adhering to the infection prevention and control practices that we had in play in the past. So I remain confident that we've done as much as we can to protect our school environments, but it takes a community to keep them safe and reduce the risk, in particular after school activities.
Next question.
Your next question comes from Colin DeMello from CTV News. Colin, please go ahead.
Hi, good afternoon, Dr. Moore. On the new acting medical officer of health in Haldeman, Norfolk, his past comments, I'm sure some of which you've heard on COVID-19, have caused quite a bit of controversy. Most notoriously, he recently said on Twitter, quote, "live free or die." So he's going to have a seat at the table, making recommendations, obviously, to you on what to do next. Are you comfortable with having that voice at the table?
Well, just for clarity, the Board of Health of Haldeman, Norfolk, hired this individual as an interim medical officer of health. They didn't need approval by the ministry, the minister, or myself. They can do that independent, and they have struggled to find a full-time medical officer of health. We're very willing to continue to work with them to try to recruit someone who has the credentials required, so a Master's of Public Health or specialty designation in public health and preventive medicine, and to provide guidance to them. If and when this individual is hired, and I believe the date is September 14th, the Chief Medical Officer of Health has the duty and obligation to continue to monitor the health of individuals in all health units across Ontario. If it is my professional opinion that the population is not being protected to the utmost through public health measures, I do have actions that I can take under the Health Protection and Promotion Act to ensure that all citizens in Haldeman, Norfolk are protected against COVID-19.
Follow-up?
Okay, appreciate it. Just on another topic, you had mentioned that all public health units are preparing for local, regional, and provincial strategies to reduce risk or transmission due to the Delta variant in the fourth wave. So can you clearly lay out for us the suite of options that are on the table so that residents in the province can have an idea of what we could potentially be in for if things start to get out of control?
Well, I think you're starting to see it. So what they've done in Windsor, where we have activity levels that are higher than most regions of Ontario, that medical officer of health has decreased the hours of certain bars, restaurants, nightclubs. And all of this is following the best evidence of how the virus is spreading in that community. He also has ascertained that there's been significant spread at multiple weddings and other ceremonies. So he's put in public health measures to protect those venues to ensure they stay open, but they can do so safely. And he's also put in actions to safeguard their schools and to decrease the risk of spread in schools given the community activities higher. So that suite of options, I think, should help limit the spread of COVID-19 in that environment, keep businesses open, and also they're forging ahead with additional measures to try to increase immunization uptake. That is the type of response that we'd like to see at a local level or a regional level if we're seeing the virus spread. And that is what we've been preparing all summer long to do, is to use our actions as public health officials to keep our businesses open, to safeguard those environments, and work with our communities and businesses to ensure safety is adhered to.
Last question.
Your last question comes from Jeff Gray at the Globe and Mail. Jeff, please go ahead.
Thanks very much. Dr. Moore, I wanted to ask just back to the testing question. Can you lay out for us, should we be concerned, given what happened last fall when students returned to school and the testing system was overwhelmed? Are you confident we're not going to see a repeat of that? There have been some concerns raised by the medical officer of health in Niagara that we don't have enough infrastructure there to test the numbers of kids that are going to get coughs and so on when school returns.
Yeah, very good question. So we started by first reviewing the evidence by the symptoms for children to make sure that that was very specific to COVID-19. We know that in September and October, rhinovirus, so runny nose virus, takes off, as well as some other croupy viruses that make children have barky coughs. And we tried to ensure that parents wouldn't have to bring their children to get tested for those specific symptoms. And if a community has an increased risk of COVID-19, that symptom list can be modified to be more extensive. But we think it's a reasonable list for all communities in Ontario at present that will minimize the burden of testing for parents and children and keep children in the classroom and keep parents from having to worry and wait for the 48-hour turnaround time. We've also built significant lab capacity for PCR testing, and we have a world-class laboratory system with Public Health Ontario, as well as our health system, both private and hospital partners, that we've built capacity for at least 70,000 tests a day with rapid turnaround time. And our public health agencies are prepared to rapidly respond to any positive case, with over 90% of cases being contacted within 24 hours and their contacts within the same time frame. So all of that capacity has been built. Yes, we have a year and a half of experience under our belts to be able to respond to any rise in cases of COVID-19. And in addition, we're having an extensive rollout of rapid antigen testing for high-risk environments as well that can be put in play if community rates rise. I hope we don't get there to the 200, 300 per 100,000 mark, where a more broad-based antigen testing can be made available, and there will be less false positives in that environment. And it takes a community and takes every Ontarian to ensure that we remain a low-risk environment like we are now.
Follow-up, and this is the last question.
Thanks. Yeah, just to follow up on that, my understanding is the lab capacity is there, but you're confident that the assessment center capacity is there. Dr. Hurd, you mentioned that he's only got one assessment center now in Niagara, where there used to be three. Have we got the same level of people ready to stick these things up the noses to get enough tests done, get the samples actually taken?
Yeah, so we'll have to monitor the as a production side, you'd monitor throughput, how many patients you can see per hour, per clinic, and ensure that they're working efficiently and effectively. And if, despite being highly efficient and effective, we need more capacity, we can work with Ontario Health to build more capacity. We've certainly had discussions all summer long with our pharmacy partners, our primary care partners, the large family health teams to ascertain how they can be involved in the assessment and testing strategy. And that is best organized at a local level. So if the medical officer of health wanted increased testing capacity, he should be working with his Ontario Health partners. We certainly have looked across Ontario and have thought we have enough capacity, but that can be leveraged if and when necessary.
Thanks, everyone.